A very big thank you for joining us on today's edition of the program Woman to Woman. We have to talk about women's health today, and that's why we decided to focus on the topic psychological traits and women's healthcare preferences. And we've decided that we'll bring a researcher, but don't worry, you meet her very soon. As a woman living in Nigeria, I've experienced firsthand the challenges of navigating the healthcare system. But I'm not alone. Millions of Nigerian women face similar struggles every day. So in this program today, Woman to Woman, we will explore the healthcare preferences of Nigerian women and what they mean for our collective well-being. In Nigeria, maternal mortality rate remains high, with approximately 804 deaths per 100,000 live births. But what do women in Nigeria really want when it comes to their healthcare? Today, we will delve into the preferences and priorities of Nigerian women when it comes to their health. I have Dr. Josephine Aikpitanyi with me in the studio. I like her name more, Aikpitanyi. She's a maternal health researcher, and currently she's working on a research topic that relates to this, what we're talking about today, and we had to pull her down. Now, she's not been in Nigeria for a while, but this research had to bring her to Nigeria. Good afternoon, welcome.
Thank you very much, Daisy.
It's such a delight to have you.
It's good to be here.
It's been a while. So when you came into Nigeria, how did you feel?
I felt very hot. It was hot, but
Very.
happy, yes. Happy to be home.
Yeah.
But the weather
the
at this
feeling.
period is hot.
It's not funny.
No.
Okay, so we're talking about psychological traits and women's healthcare preferences. I find it difficult to relate this together, but that's where you come in. So what's the relationship between someone's traits psychologically and their preferences when it comes to their health?
Okay, thank you. First, we'll ask what are psychological traits. So these are enduring patterns of behavior that does not change with circumstances or environment. So this is the sum total of who you are. Your psychological traits, your personality traits make up your personality, make up who you are as a person. And so I started my research thinking I was not delving into psychological traits, but as a Nigerian woman that have been in the process of childbearing, you wonder sometimes why the maternal mortality rate remains high and why women choose the kind of care that they choose.
Yeah.
And so I started research on women's healthcare utilization and started reading the literature, reviewing the literature to see what has been done in high-income countries, because women also give birth in high-income countries. And why are they not dying as much as women in Africa, sub-Saharan Africa, are dying? So there must be something. And you know that maternal mortality is preventable.
Yeah.
And so we started digging to know what also influence. Find there have been a lot of literature on cognitive, normal, ordinary education, the cognitive traits, how it influences. But there have been a little research done on psychological traits in sub-Saharan African countries. But in high-income countries, you see that this has been dealt on. And so the sum total of your personality influences the kind of care you choose.
Wonderful.
And so that's how I started working. And then the problem, as often in research, is data. So I have supervisors here and abroad, and they say psychological traits, what are those ones? And so I have been dealing on a particular psychological trait, which is the locus of control.
Okay, what's that?
So what is the locus of control? The locus of control is the extent to which an individual believes that life outcomes are a result of their own behavior, a result of their own choices, or outside of their own choices. For example, an individual could write an examination and say, oh, I passed this examination because I put in effort to read, study, listen, attend classes. Also, I passed, or I failed because I did not read well. Another individual could say, oh, I did not do well because the lecturer does not like me.
Word.
So these are two individuals. And so the concept of locus of control was developed by Julian Rother He's a psychologist in the 1960s, and he describes two individuals. The one with the external locus of control and the one with the internal locus of control. So the one with the internal locus of control believes that what I put into life is what I get. My actions determine the consequences and result, while the individual with the external locus of control believes that no matter what I do, if it is not going to be good, it is not going to be good. So it's
wonderful.
Influenced by luck, by chance, by powerful others. This concept had been used very often in the educational sector, but hardly
in health,
especially in sub-Saharan African countries. But it has been gaining recognition in high-income countries. And then you begin to see that individuals with internal locus of control take more charge of their health. And so they're going to utilize preventive care. They're going to use healthcare facilities more than the individual with the external locus of control. And then we began to bring it down to sub-Saharan African setting and applied it in maternal health. And so that is the psychological trait.
Okay.
And then there are others. I focus mainly on locus of control, but then there are others that I also work on. They are the personality traits. Yes, each of us has our own personality. So sometimes we just say, oh, this person is extroverted and this is introverted. But being extroverted and introverted are just two sides. Along the spectrum, there are other traits. So when we talk about this, the personality traits, we have the big fives.
Okay.
So these are the big five personality traits. You have the agreeableness. How agreeable are you as an individual? You have the conscientiousness, the ability the tendency to be able to organize things. You have the neuroticism that borders on emotional stability of an individual. Then you have the openness to experience. And then you have the extroversion.
Interesting. Okay, so in all of this findings, so far so good. I mean, research is always continuous.
Yes.
But what kind of healthcare do you think women in Nigeria specifically prefer at this aging stage?
In my previous research, using the traits and the locus of control and the personality traits, I look at healthcare from the perspective of my research. And so at the first part of my research that had been done was looking at healthcare through the lens of the psychological traits.
Okay.
And in that, we looked at utilization of care. Which of these women will attend antenatal? First, starting from antenatal, which of these women will attend antenatal? Which of these women will go and deliver with a skilled birth attendant? Which of these women will attend postnatal? And which of these women will take their child for vaccinations? And so you see how each of these traits matters along the whole birth process. I also have used self-esteem, which is also a trait.
Oh, okay.
Yes. So now I always work in collaboration with the Women's Health and Action Research Center with Professor Konofua. And so the research was done. That was the first time that a research of that nature had been done in Nigeria, especially in the southern part. And so we have publications to that effect. And now the second part of my research is to answer the question that you talked about, which will be on preferences. What kind of health care do women prefer?
Yes.
For now, I can only make a guess because I just started that part.
Okay.
I came for qualitative data collection, which I did in collaboration with the Women's Health and Action Research Center. So next year, I am going to be conducting a discrete choice experiment to answer precisely the kind of care that women prefer. The discrete choice experiment will give us a definite answer because it's going to be an experiment where women by themselves will tell us what they prefer. And we are going to be testing it using hypothetical scenarios where they cannot try to understand what we are really doing. They can only guess because it's going to be put in an experimental setting where we, the researchers, will be the one to understand the result and not the women.
The questions you're asking.
The questions you're asking.
Okay. For me, as a woman in Benin specifically, I seem to have noticed that we have a lot of women who are partial to herbal care.
Yes.
You know, they want to go there for their own antenatal. It will shock you to know that these herbal homes, they still take care of pregnant women. They give them drugs, they give them herbs. We are still here talking about women's healthcare and especially during pregnancies and how a lot of Nigerian women choose what they choose as regards their body, as regards their health when they're pregnant based on their personality and their exposure as well. And so I brought a maternal health researcher to the studio today, Dr. Josephine Aikpitanyi, and together we've been talking about all of this. And before we went on a quick break, I was talking about women's preferences for herbal medicine, and it seemed to even be on the rise now. I don't have data to substantiate what I'm saying, but I've encountered too many educated women who would rather go to a herbal doctor for care when they're pregnant, and even sometimes delivery, although not so much, but a whole lot would still opt for it because of maybe what they've experienced from previous pregnancies or deliveries and so much. But what do you think about women's decisions, not necessarily as a researcher per se, to put their trust solely on traditional care when we have the very skilled people who have spent years on years in the university studying all of this?
I think it has a lot to do with the culture. I have also encountered women. During my qualitative interviews, we had the focus group discussions with women, and despite that some women reported delivering, having their children at healthcare facilities, 95% of women attended antenatal with traditional birth attendants. I know that women go to traditional birth attendants for antenatal care and delivery, but I didn't know that it was that high.
Yeah.
Especially during the antenatal period. And so I kept asking why. And then they said, oh, the medicines are very effective. That you go there, you were sure. A woman even told me that the time that she did not have the traditional birth attendant during antenatal, she had problems with the childbirth. And so I think it's an aspect of research that needs to be looked closely into. I understand that you do things that you think are good for you, but then if we could put this up with pharmaceutical companies or association to check what is in the herbal medicine that the TBAs are giving, then I think we have something there. So I don't judge what women want, because you choose the care that's good for you. If the women believe that antenatal care with the traditional birth attendants are good for them, then I think research should delve more into what the traditional medicine contains and try to incorporate it with orthodox medicine, if possible. Because I saw this in my research, and I was speaking to my team about it, the things that I did a report on my qualitative research, and I said, I found out interesting things. That even as an African woman, a Nigerian woman, that were kind of research worthy.
Yeah.
That were kind of research worthy.
Oh, yeah.
Yes. This is an interesting aspect that needs to be looked into with the traditional herbal medicines. But sometimes the herbal medicines are being pushed aside. But if there is more research into what the herbal medicine contains, and there is a way to ascertain that these are good medicine, and then I think they should coexist side by side with the orthodox medicine.
Yeah, wonderful. You know, they do a whole lot of shocking things as well, you know, when you interact with some women, where the doctors are going to tell you, for your life, don't take a risk. We're going to have a cesarean session for this birth. A woman goes to, let's not talk about pastors. Let's just do this about. You know, you go to see your herbal care specialist. For those who believe in them, they're telling you, don't worry. we turn the baby around, and I'm like, do they really turn these babies in your womb? And then like they turn it like, with their hands.
Yeah.
And I'm wondering how these women work. But women are strong people though.
Yeah.
We're strong people. So do you think education is more of a blessing to women in terms of their healthcare in general, beyond even the natal, prenatal, postnatal, in general healthcare? As education comes to make it better for us?
Yes. I would say yes, education has come to make it better for us. More educated women should know the benefits of choosing skilled birth attendants at that period of childbirth. You know, most of the figures of maternal mortality comes from the actual period of childbirth.
Yeah.
And 2 days, within 2 days postpartum, that is when most of the deaths occur. During childbirth and 2 days postpartum,
Wow.
that's when women die.
Wow.
Yes. So, educated women are supposed to know the risk. I put it in quote, the risk. But with the findings that I have seen, your concept of risk is different from another person's concept of risk.
That's another problem.
That's the problem. And then when you say what is risk, what do you define as risk? You hear a lot of definitions. You hear a lot of definitions. During our focus group, some women said, oh yes, we must go to the TBA. One woman there, she was educated. She was the youngest in the group. She was in her early 20s.
Whoa.
Yes. And she said, I have had 2 children and they are 2 TBAs. I prefer the TBAs. And then I said, why? She said, because the quality of care is good. She has not even tried. So that's why I said it's mostly a cultural thing.
Yeah.
And it's mostly depends on the people in your circle of influence. What is being discussed. So if she is going to make recommendations for her friend, she's going to recommend the TBA.
Yeah, she
because
will.
the TBA is good for her. She's educated. And so that's why I deal more on psychological traits, because I am going to delve more into my papers to know the category that she falls into. Yes, I want to know.
We can make you start exposing all of these researches now, but
Yes.
no, you have to keep some things private.
Yes.
Well, I'm sure if you're still in Nigeria at the time and you're done with your research, we might bring you back here. So let's talk a bit about your findings in general and in total. And so far, so good on all of this. What's your advice to women, to government, to the specialists that render all of these health services to pregnant women? Because I also believe every hand must be on deck
Yes.
to deal with making women have informed choices. Our body is ours and we should make the best choices when it comes to anything that pertains to us. So in final words, for all of these people involved.
I will say first to the healthcare professionals, I know that my part is to understand why women choose to come or not to come. But then I see a lot of issues with trust, a lack of trust in the healthcare system. My first appeal will be to the healthcare professionals. The women are humans, especially that period of pregnancy and childbirth is a vulnerable one. And working on psychological traits, you could see that some women tend to be more erratic than others during the period of pregnancy. So I appeal especially to the nurses to please be gentle with our women, because sometimes, yes, so there is this kind of mistrust in the healthcare professionals.
Yeah.
And so if we all put our hands on deck to say, please, we know that the healthcare system is not as it should be, but we can all do our best
To make it better.
to make it better for us. It's our country. It's ourselves, women to women, woman to woman. You have been in the process. Maybe another person does not understand it. So we need a kind of trust between the woman and the healthcare professional. I think that will help. So for the part of the government, I think that There is still more to be done in the area of research. Like we just mentioned with the traditional birth attendant, we need to know if there is a way to let the traditional medicine coexist with the orthodox medicine. Maybe then if it is tested by the pharmaceutical companies and packaged in a way that we know what constitutes what the women are taking in, it could be good for the doctors to also understand better why women choose that over orthodox medicine. So, so that is an area of recommendation. And so also, when I finish my research in 2025, I am going to make more recommendations on exactly what drives preferences, what drives women's preference for the place of childbirth.
Beautiful.
Yes.
Right.
So we are going to make hypothetical scenarios and choices for the women and ask them to choose what they want.
Interesting.
And so then we'll be able to make concrete policy recommendations on choosing.
I could tell you more. I want to say thank you to Dr. Josephine for taking our time to be here today and share a little insight into what she's researching on. And for one, I'm so glad to see women thrive in whatever field of study they choose. And we all need to support ourselves, woman to woman, because women have to work twice as hard to achieve half of what men achieve. It's more like a man's world, even though they say the women run the world. But when you get into professional fields, you understand. And so I'm also going to use this medium to appeal to governments, agencies, and governments in general to pump more money into research studies that pertains to women. The women is actually the society. We are the ones who will make us have a better tomorrow. We are the ones who reproduce these children and most times often care for them, be there to nurture them. So more researches into all aspects of a woman's health should be done, and of course education. We need all of this to make informed choices and not totally depend on only telemedicine, the internet, and some other things that are not enough to form opinions. But that's how we're going to be concluding Woman to Woman today. And we will be back again next week, that's for sure, with a fresh edition on the show. And this time around, I'm quite positive we'll be focusing on making 2025 a better year for women in general. So keep your dials locked on to Invent Television. I am Daisy Lear Asikidi. One more time, have a swell time.